He's the author of inspiring books, A Life Worth Breathing, now published in 5 languages, and his recent book, There's No App for Happiness. His method, Inner Access, is a system of field-tested skills and techniques that can get immediate results in relieving anxiety and stress. He's a dynamic speaker. He has presented 3 TED events, multiple keynote speeches, and created a wellness program for corporations that has just launched for the Supreme Committee for Delivery and Legacy in Qatar and is already in demand. Max is recognized by the Yoga Alliance USA at their advanced teacher level. It gives me an honor to present Dr. Max Strom, who's going to talk about There's No App for Happiness. And you haven't got a presentation? You want to speak here?
I think I'll speak here. Yes. Assalamu alaikum. I like this greeting very much because it reminds us what is important, that peace is important. And that's a word I haven't heard yet today, although it's been implied, obviously very strongly, that in order for us to be healthy, we have to have some peace in our life, particularly what Chris was just talking about in the emergency rooms. If you live in chaos, it makes you live in a very unhealthy way. And whether it's an emergency room or your own life, if you create chaos and make it a habit, you're going to be unhealthy. You're going to tend to eat poorly. You're going to tend to have difficult relationships because you will be difficult. I mean, think about it. When you're happy, do you tend to behave better or worse? I'll make it easier for you. When you're angry, the next person you speak to, are you more likely to be patient or less patient? Yes, it's obvious, isn't it? Yeah. Happiness is really the subject of our lifetime, yet we rarely discuss it. Right now we're experiencing 2 trends. Internationally, we're experiencing 2 trends. One is the explosion of information technology. You all know this, you have some of the results in your pocket. Your smartphone. We didn't even have smartphones 10 years ago. We had cell phones, we didn't have smartphones. What is possible now is extraordinary. What will be possible 10 years from now? More extraordinary. But the other trend that's happening is the decline in happiness worldwide. Did you know that? Now there are some statistics that debate this, but if you look at the use of emotional medication, it's undeniable. The amount of people who live on emotional medications is skyrocketing in this country, in my country, across the world. Anxiety, depression, sleep issues, rage are going through the roof. It's interesting, isn't it? In this time of the technological revolution, we don't seem to be responding to it that well. I think there's a connection between the two, a very strong connection. But this isn't the only reason that we are less happy. To talk about happiness, we have to define it. I mean, when was the last time someone asked you to do that? When was the last time someone came up to you at a social gathering and said, "My name is Max, nice to meet you"? How would you define happiness? You see, it's funny. But why is it funny? Why don't we talk about it? Do you want your children to be happy? Is it funny when you think about your children? It's not. You would do anything to make your children happy. Too much, perhaps. This is part of the problem. But we can't even talk about it. Let me give you an example. I was at a social gathering. It was mostly teachers who were women, and they dragged their husbands along to the social gathering. This was in the United States. It was very funny. Because I'm tall and have broad shoulders, people, men especially, assume that I love sports. And one bored husband saw me from across the room, and he hated being there. It was all about health. So he saw me, and he made a straight line toward me. I can talk to him about American football. Little did he know. Now, I did play American football when I was 15 years old, but that was a little while ago. So he came up to me and he started talking about his favorite team, the New England Patriots. Now, the conversation really wasn't a conversation. He monologued to me, and I listened for about 20 minutes. But what I was thinking the entire time was, it's extraordinary the knowledge base he has about this team of people he will never meet. A group of men he will never meet who don't know his name. And he has encyclopedic knowledge about their statistics, who's injured, Hall of Fame, everything, who they're married to, who they're divorced from, who has an alcohol problem. He knew all of this. I doubt he knew a tenth of it about his own friends. You see what I mean? So I changed the subject. I said, may I change the subject just for a second? And he said, okay. He was disappointed. How would you define happiness other than the New England Patriots? And he just stared at me. I think first he thought I was, teasing him. But when he realized I wasn't, he talked like a 12-year-old. There was a lot of, he didn't know what to say. That's interesting. Really the most important subject of a person's life, what makes you happy, what fulfills you, and you don't know what to say because we never talk about it. We talk about success. We talk about pleasure, delightful things. But we're missing one thing in our conversation, and I think this is why so many of us don't find happiness and are medicating themselves now, is because we don't find meaning. Meaning is what makes us want to get up in the morning. Now, some of us find meaning with our family, children. We look at our children, we raise them, it gives us meaning. But outside the house, what gives you meaning? Male or female, what gives you meaning? Is it fame? Are famous people more happy? Have you read any of the papers lately? The incidence of divorce, of addiction, among famous people is probably 90%. What about wealthy people? If you think wealthier people are the happiest people in the world, you haven't spent a lot of time with wealthy people. Sometimes also, the people who are the wealthiest in the room are also the most medicated in the room. So we know now, but we actually have statistics about this. I'm not going to present any. I'm just going to talk to you. We know that fame and wealth do not create happiness. Meaning does. Love does. Connection with other people. We not only feel connected, but we feel we're contributing. There are so many of you in here who work in the hospital. That means that you contribute to people's lives every 5 minutes, all day, overtime. And you're exhausted and you're overworked. But you go to bed at night, put your head on the pillow, and you know you contributed to this world. You know you improve lives today, every day. And this gives you meaning. Otherwise, you wouldn't do it. Who would want to become a nurse, for God's sake? I mean, when you read the description, what Chris just showed, an emergency care nurse or physician, but even not an emergency care, the hard work that medical professionals do every day, every minute, is astonishing. It's Herculean. And they get very little thanks, unfortunately, and sometimes not paid enough either. But they wouldn't do it if it didn't give them meaning. That is what they get from it. They just want a little help from the organizational structures behind them. So I'm going to give you one homework assignment. I'm one of those teachers. I'm going to send you home with something. I would like you to ask yourself what gives you meaning. And if you haven't found it yet, make that your number one life project, because this is your life. No one's going to do that for you. No company is going to do it for you, and nobody's going to create an app for this. If they could, they would have already. Now, your definition of happiness will change throughout your life. Have you noticed that? When I was 5 years old, it was very important to me to become a pirate. You know, eye patch, sword. Well, now it's slightly less important. So what that means is through the context of my life, what is important has changed dramatically. But I would say it's even changed dramatically in the last 5 years. So this homework assignment I just gave you, you will need to do, I would say, every 5 years or so. What gives you meaning? And talk with your family about it as well. Ask them what gives them meaning. You might not yet know. It might just improve the relationship. What gives you meaning? Ask your children. Sometimes children can surprise us with their profound answers to questions like this. We might even find more of our own meaning by listening carefully to what's important to a child. Because every minute we spend in front of an iPad, a phone, ignoring the children, the next thing that happens is we turn around and they're this big, and we can't get that time back. Meaning is everything. Ask any healthcare professional. Now, regarding information technology, we seem to be living like we behave as if technology is going to transform the quality of our personal life. But you have the smartphone. I've been hearing them ringing. I know you have one. Has it improved your relationships? Now, I'm not asking you if you can contact people more easily. Obviously, you can. But has it deepened your relationships with your friends, colleagues, family, children? Improved the relationship? Does your teenager communicate better? Can you reach your teenager on the phone? Do they answer your text messages? I believe there is no app for happiness. And clearly, I'm not anti-technology. I love my GPS. I have a GPS in my car. It's extraordinary. I use it every time I go somewhere. And that GPS will lead me through the city. It will not lead me through my life. It has no idea what to do. I have to make the decisions on where the next turn of my life is. Now, in biomedicine, we're making tremendous strides, and I'm sure this community especially doesn't need to be told, but we're starting to grow organs now, grow human organs, and now if I were to fall over with a heart attack and one of you doctors said he needs a heart transplant right now, you'd have to find a motorcycle rider, yeah? Because unfortunately often that's where we get the hearts from, isn't it? In a few years, some say 10, some say 20, they'll be able to grow a new heart for me out of my own cells and replace my heart. I think that's fantastic. I might actually experience that in my lifetime, perhaps. So my heart will be able to be replaced through the new technology. This is excellent use of technology. But will this technology replace a broken heart? You see the difference? Are we going to hear new songs, country western songs that say, "She broke my heart, so they printed me a new one"? Yeah. You see the difference? Technology will serve us in so many ways, but ultimately we are still human beings. Ultimately, we still need to find out what gives us meaning and how we can better connect to each other. And it is not through the blue screen in your hand. It really isn't. The blue screens, the phones, the smartphones, are so prevalent now that if this was going to deepen your level of happiness, it would have already have happened. But remember, statistics show different. So we, I think, are using it almost as a form of distraction from our own life. So why aren't we happy? Well, I mentioned one thing already. We're not educated. Did your parents mentor you in happiness? Were you mentored in school? I mean, were you taught about it? Or was it all about how to be successful? How to go to the best school, get good grades, get a good job perhaps, get a good position in the government? This is success-based. And the promise is if you're successful, then you're going to be happy. But we know it's not true. But we keep doing it anyway. But we know it's not true. So what if we mentored our children on happiness? What if we mentored in school happiness? We were just talking about the school not educating on us on diet, on healthcare practices. We could start with even happiness, meaning. So another reason besides lack of education is we are starving for intimacy. Now when I say intimacy, I'm not referring to man-woman intimacy. I'm referring to closeness of friendship, association. Everybody says they want more connection, more intimacy. And we say that as we're on our phone. Now, I don't usually make comments to strangers, but I did the other day, and I think it was perhaps rude. But I was at a restaurant by myself. Because I travel so often, I'm usually in a restaurant by myself. And sitting near me were a group of women. They were all in their 30s, 40s. This was in America. And they were all had a phone in their hand. And while they were looking at their phone, they were talking about the trouble finding a good man, a good man to marry. And they just went on and on about it, and I'm sitting eating my lunch saying nothing. And at some point, I couldn't take it anymore. Because they were all looking at their phones. So I said, may I say something? I don't mean to be rude at all, but I couldn't help but overhear your conversation. If the man of your dreams, I mean the man of your dreams, were sitting in that chair over there with a bouquet of flowers wanting to speak with you, you would never see him. You're not going to meet the man of your dreams because you're staring at your phone. Let's just start there. Lift your face up and look through the room. You're not going to find him in there. Yeah. This evidently was news to them. So what I suggest we do is a cost-benefit analysis. Now in business, this is a common term. You all know what a cost-benefit analysis is, yeah? Where you decide if you're going to do a project or a business project or a startup. You create a sheet and you put the costs, you put the benefits, usually in monetary terms. But what we've left off of these spreadsheets is what are the costs to your health and your happiness? What if those were on the spreadsheet? You think, well, why would they be? And I would say, why wouldn't they be? Because if you create a company or a business or take a job that's going to destroy you, it would be good to know that in advance. I had some students who brought this up to me when I was lecturing. I asked for questions, and a lady said, you know, you were talking about me. I felt you were talking about me the whole time because my husband found a house for us. It was our dream house that we talked about. We couldn't really afford it. It was too expensive for us. And I said, we can't afford this. He said, come and see it. He was so excited. So we went and saw the house, and it was our dream house. And he said, you know, if I work a little harder, a few more hours a week, if we cut down, you know, spend less, we can do it, we can do it. He was so passionate, so they did it. She said it almost destroyed us. He started working 70 hours a week. Because he worked 70 hours a week, he stopped working out. Because he stopped working out, he didn't sleep well. The stress went up. Because he didn't sleep well, he started grinding his teeth at night. In the morning, he was exhausted, so he drank a lot of coffee and started eating sugar so that he could function. And this just spirals down until he was far overweight. He was unpleasant to be around, and he was totally exhausted all the time. But they had their dream house. She said, it almost destroyed our marriage. I almost divorced him. I begged him to sell the house. Finally, we did. We bought a small house, and it was as if he went back in time 15 years. He became healthy again, happy again, the person I married. If they had done a cost-benefit analysis, which included how much time will you spend away from your children? Will you even see them grow up? Yeah. How much time will you be able to spend with the love of your life? And how will it affect your health? Yeah. They would have come to a different conclusion. Now, yesterday I lectured a little bit on sustainability programs. And sometimes when people hear those words, they go like this. talking about health and sustainability is a cure for sleep problems, I think. People can fall asleep just fine. But a sustainability program for yourself, I think, is basically what we are heading toward as a species. I think the human race really is starting to experience an entire paradigm shift. I've never spoken about this before. I really feel it, especially this morning listening to these gentlemen speak, that when you look at what they were saying, all of them, it's becoming a different kind of human being. It's reprioritizing how we live our life and why. We're still living like hundreds of years ago. We have technology of the 21st century, but we behave like it's the 1400s. The priorities have barely changed. Where we have to tell companies, you know what? It's a good idea to be nice to people. Things your mother taught you. Yeah? We should take care of people. We shouldn't burn them out on purpose. We shouldn't feed people things that will end their life 30 years early. We should create products that help people. Yeah? It seems like a 5-year-old could understand this. But these are the battles we're waging, but now it's happening, starting this year, last year. It's happening worldwide, where wellness programs and wellness ideas and personal wellness programs are starting to happen, and in particular with women. Women are leading the way, no question. My 2 books, both self-help books, purchased 85% by women. 85%, and not just mine. This is the norm for self-help books. 85% purchased by women. So women are leading the way. Now, I only have a couple of minutes left. So I want to mention that a practice that you can do every day that will help you so much, and sounds so bizarre when I say it, perhaps, is learning to do breathing exercises. I was doing them just now before I came up, so I could speak clearly. Anything that makes you tense, you can make yourself de-stress in 10 minutes doing simple breathing patterns. I know you may never have done it before, it might sound odd, but I teach it to people not only who are extremely open-minded, but I'm asked to teach this in corporations, the people who are the least likely to do it. So I'm led sometimes to the penthouse office, and there are the 12 executives and the CEO of a multi-billion-dollar corporation with the attitude of, prove it. Prove it. You can see it on their face. And I have to be able to say to them, I'm going to make you feel better in 10 minutes. And they go, Stand up, I ask. They stand up, and I lead them through a 10, sometimes 15-minute session of breathing exercises, and they sit down and they're in. Okay, we feel better. What else? What else do you have, you know? So I'm going to talk about that this afternoon. I'll go more into it. But it's once you learn how to do breathing patterns, it's free. Yeah. You can do it dressed as you are. You don't have to go to a special place. Just find a place where you can take your arms out and people won't tease you. People take cigarette breaks, don't they? 6 minutes. Those of you who don't smoke, haven't you been jealous of that? Excuse me, I smoke cigarettes. I'm going to leave for 6 minutes and go outside while you keep working. So I would like to see non-smokers step outside every hour for 6 to 10 minutes and do breathing exercise. It'll change your life, no question. So I said a 5-year-old could understand this. I want to leave you with this thought. We've heard a lot about the body today, and in some of the statistics we saw things like happiness. We hear the word well-being. The mind, the body, and the emotions and your spiritual life are not separate. They aren't separate. Now I know I could argue it the other way. For example, if I come into your emergency service and you have to cut my leg off, you're going to try to convince me I'm going to have a good life without it. I'm not my leg. I agree. universally speaking, philosophically speaking, I am not my body. Maybe some of you agree with me that we exist within our body. The body is our possession, but we are not our body. Okay. But while we have the body, it is ours. Our mind, if our mind is in distress, it distresses the body. If our mind is in distress, we become emotional. Agreed? Okay, emotions. When you become emotional, you can't think straight. You don't make good decisions. When you become emotional, your body doesn't feel good. You start getting a tense neck, tense shoulders, and you don't sleep well. That's interesting. From your emotions. They're not separate. And when your body is in distress from poor diet, lack of exercise, sitting all day, whatever it is, car accident, when your body is in distress, you're emotionally in distress, and your mind is in distress. They are not separate. So besides the extraordinary suggestions, which I completely agree with by our other guests today, I completely agree with, I just want to add, your emotional life is part of your health practice. Breathing is a free tool that you have that you can access at any time. And once you learn it, you're going to write me an email and thank me. Yeah. Whether it's from me, I don't care who teaches it to you. But when you learn to do breathing patterns, I promise you, your anxiety will go down. If you do 15 minutes of breathing a day, it is likely you will give up smoking without effort within a few months. Most of my students do. I never tell people they should stop smoking, ever. I just teach them to do breathing work, and they stop. It helps with asthma. But day to day, it helps with, I just had a terrible conversation with that person over there. So I'm going to step out for a minute. I'm going to do breath work, and I'm going to feel better. This is being utilized by top athletes all over the world. I'm not saying it's just my breathing work, anybody's. The top golfer in the world, breathing exercises. The German soccer team, who won the World Cup a couple of years ago, yoga and breathing. The New Zealand All Blacks rugby team, yoga and breathing, 8 years. Yeah. American football team, Seattle Seahawks, yoga, breathing, mindfulness practice, and diet, I think 6 years now. LeBron James, world's most famous basketball player, avid yoga practitioner and breathing practitioner. I'm telling you this, especially ladies, to share with your husbands. Because when the husband says, no, I don't need to do that, that's for women, say, really? Look at this list of men who practice this. Super athletes that you watch on television. Yeah. So I will end there, and I would just like to know if anyone has any questions before I step down. Excellent. Thank you so much for the honor of being here. It's my joy.
Thank you, Max. So that concludes the morning session for the symposium today. Just a recap, we have got a break for prayer and lunch now, and we're going to basically reassemble at 1 o'clock, but that will be in the PGC auditorium in the upstairs on the third floor in the red carpet. It will be a teleconference live from Cleveland Clinic, where they're going to talk about healthcare and well-being, what is needed and what is required to start yourself. It will be about 45-minute session, and it will be live telecast in the PGC auditorium and in the classrooms as well. And after that, the delegates can split into respective tracks, which is the healthcare track, which will be in PGC 1, the public health track in PGC 4, and the executive management track in PGC 3. Thank you.